Welcome to our Common Skin Disorders in Children lecture. I hope you will enjoy learning this chapter. Learning outcomes. At the end of this lecture, the students should be able to identify the common skin disorders in children, understand the clinical presentation of the disorders, note the treatment for the disorders. The common skin disorders in children that will be covered in this lecture are atopic dermatitis, impetigo, scabies. Atopic dermatitis. What is atopic dermatitis? It is a common chronic relaxing inflammatory skin disorder, characterized by intense itching, dry skin, inflammation and exudation. Epidemiology. The prevalence of atopic dermatitis is on the rise. Affects 20% of children in developed countries, while it is heading towards this figure in developing countries. 50% diagnosed by 6 months of age. 30% between 1 to 5 years old. Often familial. Typically long-term. 1/3 of patients have persistent disease into adulthood. Major features include pruritus. Typical morphology and distributions are facial and extensor involvement in infancy and early childhood, flexural lichenification and linearity in adolescence, chronic relaxing dermatitis, personal or family history of atopy, minor or less specific features, extreme dryness or xeroses, IgE reactivity or elevated serum IgE, cheilitis or inflammation of the lips, scalp dermatitis or cradle cap, susceptibility to cutaneous infection. Triggering factors. Infection. This can be caused by bacterial, viral or fungal. Irritants. Irritants include hand washing soap and detergents. Allergens. Allergens include food, for example egg, peanuts, milk, fish, soy and wheat. Aerode allergens, for instance house dust mite, pollen, animal dander and molds, can also be among the triggering factors. The other triggering factors are sweating, emotional stress and extremes of weather. What is the goal of therapy? Control skin inflammation. Control pruritus. Control secondary infection. Finally, the most important part of treatment is to ensure compliance. General measures. General measures include bath and emollients. Aqueous cream or emulsifying ointment are used instead of soap. Avoidance of triggering factors, for example avoiding woolen toys or clothes and reducing use of detergents. Wet dressing can be used for severe widespread eczema. Finally, antihistamines can be used as sedation and antipyretic in children ages 2 years and older. Anti-inflammatory. 1% hydrocortisone is the commonest cream or ointment used. These are used as short-term treatment of acute flares. Treatment of secondary infections. Treatment can be systemic or topical depending on severity. Infection can be due to bacterial, for example Staph aureus, or viral, for example herpes simplex. Impetigo. What is impetigo? Impetigo is a superficial contagious skin infection occurring in epidermis and or dermis, associated with formation of blisters. This is the most common skin infection in children. These images illustrate examples of impetigo. Types of impetigo. Impetigo can be divided into non-bullous and bullous form. Non-bullous form is the commonest type. The main culprit is Staph aureus. It is also caused by group strength beta hemolytic. Impetigo starts on the skin of face or on extremities. Begins as a tiny vesicle or pustule and develops into a honey-colored crusted plaque, usually less than 2 cm diameter. Bullous form occurs less commonly. The causative agent is Staph aureus. Usually appears as flaccid transparent blisters. Bulli increase rapidly in size and number and then rupture. The usual affected areas are on the face, trunk, extremities and buttocks. Diagnosis. Diagnosis is mainly by clinical features and examination. However, cultures of fluid from the blisters may yield causative agents. In case of a very ill patient, blood cultures should be performed. Complications. Post-streptococcal glomerulonephritis. Rare complications include septicemia, osteomyelitis and cellulitis. Treatment is divided into localized or generalized infections. Localized infection can be treated with topical mupirocin or fusidic acid. On the other hand, generalized infection can be treated with oral or intravenous cloxacillin or erythromycin. Scabies. What is scabies? Scabies is an infestation caused by mites Sarcoptes scabiei affecting any part of the body and is transmitted by skin-to-skin contact. Mites burrow into skin where they lay eggs. Absorption of mite excrement into skin capillaries leads to hypersensitivity reaction. This leads to generalized itch, especially at night. Signs. Characteristic silvery lines may be seen on the skin where mites have burrowed. Classic sites include the interdigital folds, wrists, elbows, umbilical areas, genital areas and feet. Apart from the classic scabies, there are also nodular and crusted or Norwegian scabies. Nodular scabies manifest as papules or nodules. Crusted or Norwegian scabies are usually found in young infants or immunosuppressed patients. Widespread infestation can cause hyperkeratotic and crusted rash. How to diagnose scabies? Scrapings taken from burrows and examined under light microscopy may reveal mites. How to manage scabies? Provide complete explanation on disorder. Treat everyone in household or close contacts even if asymptomatic. Bedding hand towels are changed and cleaned in hot wash and then ironed. Treatment of scabies can be divided between infants and children. For infants, permethrin lotion. 1 application and repeat another application after 2 weeks. To be applied to whole body and may include the face if lesions are found on the face. Overnight 8 to 12 hours and wash off the following morning. Crotometon cream. Apply to all lesions 3 times a day for 2 weeks. On the other hand, for children, benzoate lotion or EBB. Apply to whole body from neck down. Wash after 8 to 12 hours for 3 consecutive nights. Permethrin lotion. Sulfa 3 to 6% with calamine. Apply to all lesions 3 times a day for 5 days as antipyretic and to provide symptomatic relief. Antihistamine. This may also be helpful in relieving the itch. In summary, atopic dermatitis, impetigo and scabies are common skin disorders in children. It is important to correctly identify these skin disorders so that appropriate treatment can be delivered to patients. Here are the reference I hope you enjoyed learning this chapter. Thank you.